I would open. Now let me ask you, if I were to mess up, let's say we mess up, and I touch something I'm not supposed to, what would it go do? You get a new kit, that's right. And you know that the what? The outer 2 inches is what? Considered what?
Contaminated.
Contaminated. Now, come over here, I want you to look at this. This one's new to me, and I'm a demonstrator, right? Now, it appears those gloves are on top. See that? And it looks like that this one might go on this hand, and I'm assuming this one goes on this hand, wouldn't you think? That's what I think.
Yeah.
But before I do this, once I put the sterile gloves on, I'm trapped. So I know I'm going to need some saline for the suction. So I'm going to go ahead and what? Open it. And if it was a new one, I wouldn't have to lip it. But if it's a, this one is what?
New.
This one will be new. I wouldn't have to, but otherwise you would what?
Lip it.
Lip it, okay, and put it back up on the bedside table. Okay, leave the cap off of it. We're going to pretend like this is open. I'm not going to open it. Okay, is there anything else I need to open? It doesn't appear that I do, right? So I'm going to put the gloves on. How do you put the first glove on? I'm going to pick this glove up because you can grab it by the cuff. See the cuff? See like that? Now, it looks like it goes on this way. Let's see. It may not. You know what? They're a little small is what it is. Trying to get my thumb. Let me show you something. Here, this is the most important. You know why? Because I'm going to have to go where? Underneath this glove, right? These are, I tell you, these gloves are just a little small on me. But that's okay. You see? Doesn't matter, does it? Have I contaminated? Well, it doesn't matter if you look like an octopus over here as long as you got all of them gloves. Okay? Right? Now look here at this big old thumb, my big thumb. Ready? Okay, now look. Am I still sterile?
Yes.
Okay. This right here, I'm not going to mess with it because I might touch skin. I know I'm sterile from what? This point up and this point up. Now I've got my gloves on. Had you not opened the saline, you're in trouble because now you have to get the cap off of it, right? You still have to contaminate your hand if you didn't open it, right? Even if you held it in your teeth, right? Okay. So now that I've got my gloves on, I can what? I can touch everything, right? Can I touch this? Okay. Can I touch inside of it? Can I touch the top of it? Let's see here. This is the little cup. There we go. Can I do that? Sure. Okay. Okay. And here's the catheter. Can I do that? Can I do this? Okay. Now sometimes, like I said, sometimes the tubing is on top. So what I do is I pinch the tubing up, right? Slide it to the side because inside is what I'm wanting. And if you don't like the way it's set up and you like to put your gloves on first, if the gloves are on the bottom, do what I done. What? Flip it over. Guess what's on top now? The gloves. I like to put my gloves on first. I've always been put the gloves on, and I'll tell you why. Because I like to be able to work with my tray without fear of contaminating. Okay? So this is all sterile, right? Okay. So what I have to do is I'm going to have to contaminate a hand, okay? This is a sterile catheter. This is the hookup to the suction, okay? So I'm going to have to contaminate a hand, okay? What I would do is, if I want to contaminate, which hand are you, right or left-handed? If you're right-handed, you want to make sure that the catheter is what?
In the left.
In your, no, in your right hand, yeah, to keep it sterile. So is that sterile? Now I have that.
Yep.
That's sterile, right? Okay, so I'm going to have to contaminate a hand. I'm going to have to contaminate a hand to hook this up. I'm going to have to contaminate a hand to turn the suction on. I'm going to have to contaminate a hand to pour the saline in. This hand is contaminated. This hand is sterile. Saline. Contaminate, right? And I hold mine up so I know which one it is. Okay? It's contaminated anyway, right? Okay. Contaminate, right? Sterile. contaminate. Okay. Then I would contaminate. Turn the suction on. We need some sound effects. Okay. What would you suction at? What pressure would you suction? In other words, when you apply suction, what they call intermittent. See this hole? When you apply the thumb, and this is okay, it's a contaminated hand, as long as the catheter is sterile that enters the trachea. That's what you want, the respiratory tract. You suction with the non-dominant hand, and it's the contaminated hand, right? So when I apply suction, when I take this and dip it in the normal saline, is it sterile? Yes, this is still sterile. Sterile to sterile is sterile. So I'm ready to go, right? Okay. Now, was there any KY in that? Usually there's KY. Okay. We got some KY. We put a KY. But would you open the KY? That was not in the kit. So if it wasn't in the kit, what we should have done was we should have went and got some KY and opened it, right? Went ahead and put it out somewhere, right? On the sterile, we could even done it on the side here, could we not? Right, okay. We could just squirt it on there, and then we could what? Put it here, right? Now you're ready to go. What's the pressure of the suction? Intermittent suction.
80 to 120?
80 to 120. There you go. If you have to pick wall suction, choose 80 to 120. That's for suction and GI suction. And that is in millimeters of mercury, just like your blood pressure. You know how your blood pressure is 120 over 80, or it's 120 and 80? Think of a blood pressure.
Okay.
80 and 120, okay? And it's in millimeters of mercury, so is the suction.
Okay.
So it's the blood pressure upside down.
Okay.
Okay? So we check, lubricate, right? And yeah, I'm surprised that the lubricant was not in there. It should have been in there for the suction kit. But I didn't notice it either. But if we were in the real live world and I was to that point and didn't have the KY, guess what I'd have to do? Start over. But when you do it on a patient, I'm just share this with you, it's a little different. You know, you may tell me you forget to pull the curtain around the patient here, but when you get into the clinic, you'll automatically do it because it's a real person. You know what I'm saying? And it joggles your memory, okay? All right, so suction, 120, and we've lubricated, right? This is still sterile, right? Look in there and see if there's any KY. That bothers me. So there should be some KY in it, no? All right, okay. So the suction, go in. It's just like the NG tube, okay? When you get back to the back of the throat, guess what they're going to do? What? So pull it back. Okay. Now this time, instead of you're not wanting to enter the esophagus. This time you want to enter the trachea. You want to. So you would not want them to swallow, because if they swallow, what would happen? It would close off, right? So what you tell the patient is, you say, take a deep breath. And as soon as they take the deep breath, just as soon as they take the deep breath, when you advance the catheter to go into the trachea, and they will cough. That's normal, right? They will cough. And when you go down, you irritate the carina, and it'll make them cough. You go down 4 to 6 inches, okay? And then you notice I'm not applying any suction on the way in. It can traumatize the respiratory tract, and it can make the tube stick to the tract, and you can't advance the catheter. So once you get down there, then you would apply intermittent suction, which would go a little like this. You go pull back, pull back, pull back, and pull back, okay? So you do, just as long as you do it intermittently. You don't suction all the way back out. In other words, you don't hold your thumb and pull the catheter out. You do it the way I do it. You can pull it out normal if you want, or just easy. You can suction and just pull the catheter out slowly. If you want, I pull it out, suction, pull it out, suction, pull it out, suction, pull it out, suction until I'm done. Okay? That's one pass. You can make 3 passes with the catheter. Okay? Now, is the catheter contaminated?
Yes.
It is, but it's contaminated with the patient's own germs, so to speak, right? In other words, you've not introduced anything on the catheter that's going to cause an infection. Does that make sense? You see, the catheter is contaminated, but it's contaminated with the students, with the patient's own secretions, right? Own body cells, own germs or microorganisms, right? Okay, so then how would you determine if you needed to make another pass? Would you always do 3? Not necessarily. You could do 1. You might do 2, or you might do 3. What would make the difference if you would do 1 pass, 2 passes, or 3 passes? What now? The amount of secretions could have something to do with it. How about listening to the patient? If they're still gurgling, I would go again. So let's go again, okay? Now, the 2 complications that you can run into, you remember vagal stimulation? Okay, the catheter can irritate, and I'm going to talk, okay? I would not do this to a patient.
Right.
When the catheter is inside the bronchus, right? Inside the tube, or not bronchus, I'm sorry, but the trachea, it can actually cause the bottom, the bronchi, any stimulation of the respiratory tract can cause bronchospasms. Does that make sense? And you can actually have a patient go into a bronchospasm during the suctioning. You can also have the patient go into cardiac arrhythmias. So the 2 complications of suctioning is bronchospasm and cardiac dysrhythmias while you suction the patient. Okay, second time. And I saved the best for last, okay? We're out again. That's the second pass. The patient still sounds a little moist. What would you do?
Do it again.
Number 3. Down we go again. Down the hatch, right?
Why can't you only do it 3 times? Is that just the gold
That's the
rule?
standard is 3. You use the catheter 3 times. That's what that's textbook fashion. That's
Okay.
safe practice, evidence-based
Gotcha.
practice. Yeah, 3 passes. Okay. Down and what?
Just like that.
Only on the way out, right? And then you listen. And then I would. This is still good, right? 3 passes. I'd turn this off and listen. They sound clear, so you're done. Now, before you give, this is textbook buzzwords. Before you suction a patient, the correct procedure is to administer 100% oxygen before you suction the patient. The reason being is you hyperventilate, so to speak, the patient with 100% oxygen, because not only are you pulling out what?
Their
Secretions,
air, pulling out air.
you're pulling out air, right? And you're blocking the partial airway. So the oxygen concentration would go what? Down.
Down.
So what you do is you hyperoxygenate the patient, so when you suction, everything goes back to normal. Does that make sense?
Yes.
So they love to ask that sometimes. You want to hyperoxygenate the patient with 100% oxygen before the suction, okay? You all know intermittent suction. You know your pressure. Now, you need to know how long that you can suction. In other words, when the time you get it in, we're going down this is really the first time. I got a new catheter. I know y'all saw that. Okay, here we go. You don't have to, I've seen students go, they try to get it out as quick as possible, and this patient is still gurgling. Okay, you don't have to be that fast, okay? Okay. Once you're down, you can walk. The patient will appreciate it. You can suction for up to 15 seconds, okay? No more than 15 seconds. And again, it's intermittent suction, and it's only on the way out, okay? Never on the way in. So hyperoxygenate, lubricate, sterile, down 4 to 6 inches. They'll cough. Intermittent suction for no longer than 15 seconds at 80 to 120 millimeters of mercury, like your blood. Remember we talked about the blood pressure numbers. You can remember it that way. It's got the normal buzzwords for blood pressure at 120 over 80. Now, suctioning is not something that you routinely do. And what I mean by that is you don't go in and suction Miss Clark every 2 hours just because she needs maybe at time to time. You suction as needed, okay? Remember that. You never schedule a suctioning on a routine basis. The patient may not need the suction, right? You suction as needed. In other words, if I suction the patient now, and 10 minutes later, the patient was gurgly again,
You wouldn't
I would what?
wait.
They need it,
Oh, you
right?
do it?
Can't breathe.
Hyperoxygenate, right?
Okay.
Get you a new sterile setup, right? lubricate, check it with suction, and I didn't show you this, but you would cleanse the tube with the saline. That's why the mucus inside the tube. Second pass to clear the tube. Third pass. Okay. So you suction is needed. Some patient may need suction every 15 minutes for an hour, but then after that, they may not need it for 6 hours.
Would you have to get a
So-
new kit every time?
After the 3 passes,
You
and
throw
you
that
leave,
away?
you'll throw this away.
Okay.
Okay. That doesn't seem that hard, does it?